The cloud. There we go. All right. Welcome, everyone. My name is Beth Foss, and I am the Director of Operations at the CRF. And I'm going to be using some of my notes today as I share a little bit more about our presenter, because it's a lot to say. It's a mouthful. But I just want to welcome everyone to our webinar today, especially Dr. Calzetti, who is joining us at supper time in Italy. We greatly appreciate it. Dr. Calzetti comes, as I said, from Italy, and I just asked him, and I can't pronounce it. However, it's somewhere between Milan and Venice, and it sounds super beautiful. I wish I could go there quickly. But he's going to be talking with us today, guys, about retinal oxygen metabolic function and basically using new imagery to measure oxygen levels on the retina. And I know that there were a lot of people, perhaps other researchers, that were very interested in your work as well today. Dr. Calzetti did live close to me. He went to UPenn for a little while, knew some of the researchers that have been active in the CRF. But he went back home to Italy and started a center for IRDs, concentrating on IRDs there. So that's where he's joining us today. Dr. Calzetti serves on the board of the FFB and works part-time at the Institute of Molecular and Clinical Ophthalmology in Basel, Switzerland. And we're just super great and grateful that you're here today. We always want to thank our sponsor, which is 4DMT, for helping us put these on and supporting our efforts in this. And so, yeah, I'll be monitoring the chat, and we'll be asking questions if appropriate, kind of as he takes a break. Otherwise, the Q&A and chat feature will be asking questions at the end. So welcome. Thanks for joining us today. Dr. Calzetti.
Thank you very much. I'm going to share my screen. Just 1 second.
Perfect.
Okay, can you see my presentation? Can you see my screen?
All right, I muted myself. We sure can. That's perfect.
Okay, great. Hello, everybody. I would like to thank the organizers for the kind invitation. My name is Giacomo Calzetti. I am an ophthalmologist. I currently work at the Vista Vision Eye Clinic in Brescia, Italy. And the presentation of today is about research I did last year at the University of Basel in Switzerland. And the topic is retinal oxygen metabolic function in choroideremia and retinitis pigmentosa. Just a brief introduction. Inherited retinal dystrophies cover a wide range of syndromic and non-syndromic clinical phenotypes. Some of them are rod cone dystrophy, also called retinitis pigmentosa, which is the most frequent type of inherited retinal dystrophy, cone rod dystrophy, macular dystrophy, and choroideremia. Although the first defect of this disease is genetic, the underlying mechanisms leading to vision loss are not yet fully understood. And in particular, there is a long history of hypotheses about ocular circulation being part of the problem in some IRDs, including choroideremia. And the ocular circulation consists of two main systems. The retinal circulation, which is a sparse circulation with lower blood flow rate, and the choroidal circulation, which has a higher blood flow rate. And if we think of the back of the eye as a cake with different layers, these two systems of the ocular circulation have a precise localization within these layers. And in particular, the retinal circulation lies in the inner part of the retina, while the choroidal circulation, the second system, lies in the choroid, which is a separate layer under the retinal pigment epithelium layer, which is the layer in between retina and choroid. choroideremia leads to the degeneration of various structures in the posterior part of the eye, including the retinal photoreceptors, the retinal pigment epithelium, and the choroid. And the ocular circulation is also affected by degeneration, by changes due to the disease. However, one problem in choroideremia is that we don't know exactly the precise temporal relationship in which the different parts are affected. However, as ophthalmologists, when we look at the fundus of a patient with choroideremia, we notice that there is a pronounced depletion of the choroid, which is, once again, the layer in which the choroidal circulation lies. This is an important difference between choroideremia and retinitis pigmentosa, because these two diseases have some similarities. In particular, they share the clinical characteristic of being rod-first diseases, which means that rod loss and night vision loss predominates early in the disease course. Rod loss and night vision loss occur earlier than cone loss and daily vision loss. So this is a similarity between retinitis pigmentosa and choroideremia. However, there are some differences, and a striking difference is that the degeneration of the choroid is much greater in choroideremia than in typical retinitis pigmentosa, and we don't know exactly why. However, the choroid is important because in the choroid, there's the choroidal circulation, which is very important because it's the main source of oxygen and nutrients for photoreceptors. And we all know that oxygen is very important for metabolism, which by definition is the sum of all the chemical reaction needed for cell maintenance and proper function. So given this background, the aim of our study was to explore the changes in oxygenation of the retina in choroideremia. And so far, retinal oxygen saturation has never been measured in choroideremia. There are indeed several ways to measure the oxygenation in the retina. In animals, it's possible to measure oxygenation of the retina layer by layer using microelectrodes. However, this is an invasive technique and cannot be applied in humans. But animal studies showed that the distribution of oxygenation in the retina is not the same and depends on the layer of the retina, and in particular depends on the consumption of oxygen layer by layer. Other animal studies using this invasive technique showed that there are differences in the retinal oxygenation between a normal healthy retina and retina with inherited retinal dystrophy, in particular retina with retinitis pigmentosa. And in particular, in this animal model, it was found that retinal oxygenation is higher in retinitis pigmentosa because there is photoreceptor loss, and because of this, the oxygen consumption is lower. So there's photoreceptor degeneration, photoreceptor loss, less oxygen consumption, and then an increase in oxygen levels in the retina, because the choroid keeps providing oxygen to a retina which is not using oxygen, and this causes an increase in oxygenation of the retina. And this mechanism is thought to be associated with an increase in possible increase in oxidative stress in the retina of retinitis pigmentosa, which can in turn further damage the photoreceptors. Going back to humans, we can measure non-invasively retinal oxygenation using some devices. One of these is the spectrophotometric oximetry, one non-invasive technique to measure retinal oxygenation. And this is a kind of modified fundus photography that can be used in eye clinics after pupil dilation with eye drops. And using different wavelengths, this technique allows us to measure the oxygenation in the retinal vessels, in particular in retinal arteries, retinal veins, and the difference between the oxygenation in arteries and in veins, which represents a measure of the oxygen consumption in the retinal tissue. And in particular, this non-invasive technique, which is a kind of modified fundus photography, once again, can perform the measurements in the retinal vessel surrounding the optic nerve, so at the posterior pole of the eye. In our study, we enrolled 9 patients with choroideremia, 39 patients with retinitis pigmentosa, and 53 healthy participants who were measured with this non-invasive technique to obtain retinal oxygenation data. All the choroideremia patients were measured, were molecularly confirmed, which means that they underwent genetic testing, and one mutation in the CHM gene was found in all participants with choroideremia. And these are the data we found. So we obtained 3 main parameters: oxygenation in retinal arteries, oxygenation in retinal veins, and the difference, which represents a measure, a parameter, let's say, of oxygen consumption in the retina. And we actually performed 3 comparisons. First, we compared the oxygenation in retinitis pigmentosa versus healthy participants. And as expected, we found that oxygenation is higher in the retina of retinitis pigmentosa in both arteries and veins, while the oxygen consumption is lower. And it's lower because there are less photoreceptors consuming oxygen. And because of this, the oxygen in the retina is higher, because the choroid keeps distributing oxygen to the retina. The second most important comparison was between choroideremia and controls. And in this case, we found the opposite. We found that the oxygenation in the retina of choroideremia is lower than in normal retina in both arteries and veins, and the oxygen consumption was lower as well. And when we compare the choroideremia versus retinitis pigmentosa, we found, in terms, again, of retinal oxygenation, we found an even greater reduction, even greater difference, let's say, between the 2 groups, with lower values of oxygenation in choroideremia in both arteries and veins, while the oxygen consumption was not different between the 2 groups. So what are the conclusions that we got from this analysis? So once again, this is the first time that these parameters are measured in choroideremia. It's a kind of pilot study on this aspect of retinal metabolism. And so in general, the data indicate that the retina in choroideremia may be a relatively hypoxic environment with less oxygen. And we believe that this could be due to the profound choroidal degeneration, which can lead to a decrease in the oxygen flow from the choroid to the retina. And also, we hypothesized that this relative hypoxia could explain some of the anatomical changes that were previously described in choroideremia. For example, Sam Jacobson, my previous mentor, described that there's a retinal thickening in the course of the disease, and this could be perhaps due to hypertrophy of Muller cells as a consequence of retinal relative hypoxia. And in general, the impact of these alterations of oxygenation of visual function, retinal degeneration, and retinal remodeling are currently unknown, and this needs further investigation. In particular, the observation of this marked choroidal degeneration in choroideremia, which is a striking difference between choroideremia and retinitis pigmentosa, raises the question of whether a therapy, including gene therapy, should be administered not only to the retina, but also to the choroid in order for it to be effective. And for the future, we plan to investigate in more detail dynamics of choroidal circulation loss in choroideremia, in particular, the interplay with the degeneration of rods and cones and the remodeling of the inner retina, and the impact of on visual function of these alterations. We believe that these findings may improve our understanding of what exactly happens in an eye with choroideremia, and may provide useful details to inform the planning of clinical trials of emerging therapies for choroideremia. So once again, we know that the first defect in choroideremia is genetic. This is clear, but the mechanisms that are leading to the changes we observe in the eye, the retinal degeneration, but also the choroidal degeneration, are not well known. And we believe that investigating these parameters, like the oxygenation and the blood flow and the choroidal structure, could provide useful information that could be used for to develop therapies for choroideremia. Okay, and I would like to thank all my collaborators in Basel and in Italy, and I would like to thank you all for the attention, and I'm happy to take questions.
That's wonderful. Thank you. Okay, here's some questions coming in, sir. We'll start at the top. Was there a difference between male and female carriers in CHM?
Yeah, that's a great question. Yes, a detail I didn't explain is that all patients were male. All patients included in this study were male. So we enrolled 9 male patients. So this is interesting, and for sure this could be another interesting topic for future research.
The next question would be, could oxygen supplementation help CHM patients orally, topically, locally, or systemically?
Yeah, another very good question. I don't know. Actually, we don't know. This was not investigated. So currently there is no evidence supporting this. So simply we don't know. For sure, I would not recommend that in clinical in clinical care based on the findings of this study.
I think we'll have a couple of these questions, but what would you think would be the next steps, and where will you go with your research next?
Yeah, as I said, I plan to investigate more these aspects, these metabolic aspects that were not investigated before, oxygenation, and in particular, the choroidal degeneration. There are some techniques now that which allow to to study the choroid, such as optical coherence tomography angiography, or, for example, laser speckle contrast imaging. These are techniques that can provide the measurement of blood flow in the choroid. And I think that as a researcher and as an ophthalmologist, the striking difference between retinitis pigmentosa and choroideremia in terms of choroidal degeneration is really interesting. And I really would like to understand more what happens to the choroid and how this can affect the disease, and how this can this information can be used to better plan clinical trials for choroideremia. So I would like to really focus on what happens on to the choroid in choroideremia, not just the photoreceptors that of course are the target, because are the retinal cells which degenerate and which are responsible for vision. But the choroid, as I said, is very important because it's the main source of nutrients and oxygen for photoreceptors, and I'm quite sure that this degeneration is affecting the photoreceptors and visual function, and possibly also the efficacy of novel therapies.
All right, we're going to keep cranking through these. What could be the reason for the surface not accepting the oxygen? I have heard, I think, nitrogen or nitrous oxide in the blood on the surface.
Oh, sorry, I did not understand this question. Once again.
I'll frame it once again. It says, what could be the reason for the surface not accepting the oxygen? I have I think she means heard, nitrogen or nitrous oxide in the blood on the surface. Could that be a reason why?
I don't know. I mean, I'm sorry, I did not understand again because I did not mention this in my research. Actually, we found so this was a pilot study, let's say, investigating this parameter for the first time in choroideremia. Unfortunately, we cannot provide answers on the reasons explaining the differences we found. We only have hypotheses, and we think that the degeneration in the choroid can cause the decrease in oxygen flow to the retina, but this is just speculation. We don't know exactly why. So for sure, it would be interesting to understand more the mechanisms leading to these metabolic changes.
You know, if the person, I don't necessarily want to use their name here, but if you want to reframe that question, please feel free to go ahead, and I'll make sure I jump to it again. Here, could oxygen levels explain some of the variation in speed of disease or progression rates across the CHM population?
Once again, it's possible. It's possible. We don't know exactly how these metabolic changes, these oxygen level changes may impact the disease. Also, another thing we would like to do is to see if there are changes in these parameters according to the stage of the disease. So we in this study we simply pulled together 9 patients, and we found this striking difference in oxygenation, but we don't know exactly how these changes correlate with the stage, with the severity of the disease. And of course, this could be another interesting research for the future.
We have a question that came in. Thank you for this very interesting presentation. How does your findings relate to recent ophthalmologist recommendations regarding taking antioxidants like NAC? Good question.
Yeah, good question. Well, there are clinical trials ongoing on neck, so there are no recommendations at all now. So we simply have to wait the results of the clinical trials, but although the clinical trials currently on retinitis pigmentosa, so anyway, there is no evidence so far. We have to wait results for retinitis pigmentosa, and possibly in the future, neck could be investigated in choroideremia as well. We don't know.
Okay. Here's a few more. Have you done any other research or kinds of research on CHM related to lipids or glucose that might increase metabolism and thus oxygen consumption?
No, not yet. And for sure, oxygen is just one piece of metabolism. There are many other players that could be studied, as you said, and would be interesting to study more players of metabolism and try to find to see how they interact. So currently, I've not studied those parameters, just oxygen. I plan to study blood flow, choroidal blood flow, which is another important player of choroidal and retinal metabolism. But again, there are many very interesting ideas on how to move forward with this research line. Thank you.
You know, based on what you just said, would there be any other recommendations that you would tell your patients with this oxygen question or the study that you're doing? Would you advise your patients to do anything differently? Perhaps take any other vitamins or change anything, exercise?
Yeah, unfortunately, no. Fortunately, my answer is no. Also, this technique I'm using to measure retinal oxygenation is currently more useful for research than for clinical care, I must say. So I think that I hope my research will be useful to better understand the mechanisms leading to vision loss in choroideremia, but currently I don't have any clinical recommendation for patients based on these findings. Possibly in the future there will be, but not now, unfortunately.
All of the work, though, that you're doing certainly are helping the building blocks of the foundation and continuing the research. And that's always a very positive thing. All right, we have 2 more questions. Do you have a few more minutes?
Sure.
Okay. Thanks for your presentation. Do you think that maybe I just asked this, physical exercise, cardio could help improve oxygenation in the retina of choroideremia patients?
I mean, there are many questions because, oxygen is an important player. There are many ways to modulate metabolism, more or less, and oxygenation. So it would be interesting to understand that more in detail. I think I hypothesize that retinal metabolism has an impact on visual function, perhaps in the short term. However, I don't have a clear answer to this question now. I hope that these findings will help clarify all these issues, that maybe there will be clinical recommendations in the near future based on this research line. But currently, this was a pilot study investigating mechanisms of choroideremia, not providing clinical recommendations.
We have another person that chimed in. So I have, again, 2 questions. Do you happen to know if AMD also exhibits low oxygen consumption?
I don't know. I didn't perform a study on AMD, just on choroideremia and retinitis pigmentosa. It's possible that there are changes in AMD. Probably yes, I would say. because choroidal blood flow is somehow correlated to the disease, and there could be changes in oxygenation also due to photoreceptor loss. Although probably these are more focal changes there rather than retina-wide changes as we observed in choroideremia. But I don't have experience on that, so far I just studied I focused on choroideremia and retinitis pigmentosa.
That's okay with us. Okay, thank you. Thank you. Eric, is there any measurement of VEGF production difference between RP versus CHM that might indicate the differences in oxygen levels?
Okay, I should note all these questions because they are really very interesting and really provide very useful topics for future research. I don't know, actually, that's a great question. Probably we know that VEGF production is strictly bound to oxygen levels, so probably it's possible that the EGF levels are different in choroideremia and the retinitis pigmentosa. However, I did not investigate this, but again, would be interesting to understand also these metabolic changes as these molecular, let's say, changes that could happen as a consequence of choroidal blood flow loss and oxygen decrease.
The final question was a follow-up to the previous one that we were seeking more information. So I'll see if I can get it correct. Not a scientist, but was told to study the exchange on the surface, which somehow was related to nitrogen. I thought nitrous oxide in blood is perhaps the interface chemical. Since oxygen is needed to metabolize the materials, it seems important.
Yeah, I don't know. I don't have an answer to this question. I'm not familiar, honestly, with this topic. So unfortunately, I don't know how to reply.
Let's see. Thank you, Doctor, for your presentation, time, and research. Thank you. You're welcome for bringing us this great information. Hope all have a blessed day. That's a great note to end on. So, Dr. Calzetti, we're just really grateful. You gave us really good information. And I think one of the most encouraging things that we always take away from these is that we have young, energetic new faces, at least to our organization, that's working on choroideremia. And sometimes what we need is even more, like I said, the building blocks and the foundational things to provide additional information to get us closer to that treatment. So we're just super grateful that you're on our bench, that you're on the team. And we look forward to seeing the work that you and your labs are going to be doing. And we look forward maybe to meeting you in person one day.
Sure. Thank you very much. It's a pleasure. I'm very, very happy to be here. And thank you very much for this invitation, and happy to share in the future next steps of my research on choroideremia.
Wonderful. Thanks so much. Everyone have a wonderful Tuesday. Thanks, everybody, and we'll see you again soon. Bye-bye.
Bye-bye. Thank you.
Bye-bye. Thank you.